Hello, my name is Joanna Crocker, and I'm delighted to have this opportunity to tell you about our collaborative project, which has identified several priority topics for health services research. This project focuses on priority setting partnerships, or PSPs, which enable patients, carers and professionals to work together to identify and prioritise unanswered research questions in particular areas of health and care. The James Lind Alliance, a non-profit initiative based in the UK, facilitates these partnerships. The partnerships follow a rigorous process, beginning with an open survey to gather people's unanswered questions and ending with a final top 10 list of jointly agreed research priorities. These priorities are then publicised widely and made available for researchers and funders to access. The aim of this is to make sure that health research funders are aware of the issues that matter most to the people who need to use the research in their everyday lives. It is designed to change the way research funding is granted, since at present it is often funders and researchers who decide what should be researched. To date, more than 100 priority-setting partnerships, called PSPs for short, have produced top 10 lists of research priorities for a huge range of health conditions and types of care. There has been very little crossover between these partnerships, as they have tended to work in silos. Yet we know from looking at the top 10s that certain topics appear repeatedly across different areas of health and care. This project as a whole has three aims. First, to describe the nature of information published by PSPs collectively so that people interested in studying or evaluating PSPs can easily see what is available. Second, to describe the characteristics of PSPs and their top 10 research priorities. And third, to identify common overarching themes in research priorities which cut across different PSPs. This will help highlight recurring themes of importance to people with lived experience and professionals across a wide range of conditions and care settings. We hope that this will encourage cross-disciplinary collaboration to address these themes and reduce duplication of research, as well as signalling topics of importance to research funders. In this presentation, I will be focusing on this third aim, and in particular, the overarching themes we have identified relating to the organisation and delivery of services. In order to address aims 2 and 3, we used the Health Research Classification System to code top 10 research priorities. This is a framework developed by the UK Clinical Research Collaboration to classify the full spectrum of biomedical and health research, from basic to applied, across all areas of health and disease. It has two parts: classification by health category and classification by research activity. Research activities are divided into 8 broad groups shown here. The 8th group is Health and Social Care Services research, which is further broken down into 5 subcodes shown here. The main focus of this presentation is the subcode called Organisation and Delivery of Services, which was by far the most common in this category among the top 10 research priorities included. This category includes research examining the organisation and provision of health and social care services and evaluating factors affecting the quality of care. Some examples are listed here. Our analysis included the top 10s of all UK-based PSPs published between 2016 and 2020 inclusive. This constituted 525 research priorities from 52 PSPs. Each top 10 research priority was coded independently by 2 team members using the Health Research Classification System. A third team member compared these codes and arbitrated in the event of disagreement. At the end of the coding process, 62 priorities, or 12% of our sample, from half of the PSPs were coded under Organisation and Delivery of Services. 2 team members then conducted a thematic analysis of this group of priorities to identify overarching themes. We defined an overarching theme as one underpinned by priorities from at least 3 different PSPs and 2 different health categories from the Health Research Classification System. We compared, discussed and revised these with input from the wider team and the project advisory group. Our thematic analysis identified 5 different themes: optimising multi-agency and multi-professional coordination, achieving holistic or person-centred care, improving access to services, understanding and reducing delays or waiting times, and ensuring patient safety. Here are some examples of the priorities underpinning the largest of these themes, optimising multi-agency and multi-professional coordination, which had 17 priorities underpinning it. This presentation has focused on the organisation and delivery of services, but we have applied the same process of coding and thematic analysis across the whole breadth of the health research classification system, as well as identifying additional categories through conversations with patients, carers, service users, funders and other end users. We have identified a large number of overarching themes, and we are now working with a design company to develop an interactive online map of these themes, which would allow researchers, funders and other end users to focus on and explore the areas of interest to them. We intend to make this publicly available in the autumn, and if you would like to be alerted when this is available, please contact me and I'll add you to our dissemination mailing list. Thank you very much for listening, and if you have any questions or comments, please don't hesitate to contact me at the email address shown. I would also like to thank our funder, the NIHR Oxford Biomedical Research Centre, my co-authors, the James Lind Alliance and the advisory group for this project for your expert guidance and support.